Okay, let's unpack this. Welcome to the deep dive. We're here to plunge into the sources you've shared, articles, notes, research, and really pull out the core insights.
And today we're focusing on something pretty critical in healthcare, using AI to improve how hospital staff rotas or schedules are managed.
Right, specifically looking at how AI can help create fairer schedules and, maybe just as importantly, help prevent staff burnout.
Exactly. Our mission really is to sift through this material and understand how AI isn't just automating scheduling, but actually making it better, fairer, and hopefully less draining for the people on the front lines.
Because the current picture, from these sources anyway, of hospital ROTA management, well, it sounds challenging, doesn't it? Often manual, very time-consuming, easy to make mistakes.
And rigid, incredibly rigid. Think complex spreadsheets, maybe outdated software that just can't keep up.
Yeah, the sources paint this picture of systems that struggle to adapt. Changing patient needs, individual staff requests, or sudden emergencies like a flu outbreak hitting a department hard.
And that rigidity, it has a real human cost. The material links it directly to staff well-beings, things like not really having insight into fatigue risk, schedules feeling unfair. It all adds up, leads to dissatisfaction, and ultimately burnout.
You read these anecdotes in the sources, right? Like Dr. Sharma feeling overwhelmed by a chaotic schedule she can't influence, or Nurse Patel just dreading the unpredictability of it all.
It's clearly more than just an admin headache. It's a major stressor.
And that stress, it affects the staff, obviously, but the sources point out it can also impact patient care and the overall health of the hospital system itself.
Absolutely. But this is where AI comes in, offering a different approach. The key thing highlighted here is that it's not just about automating the old, sometimes broken processes.
So it's doing more than just making the same schedules faster.
That's the promise, yeah. It's about optimization. AI can juggle a huge number of factors simultaneously, things traditional methods just can't handle, like individual preferences, skills, patient needs, even predicting fatigue.
Okay, so the goal is bigger. It's trying to turn the ROTA from, a source of constant stress into something that actually supports staff and helps things run smoothly.
Precisely. A tool for well-being and productivity, not just a list of shifts.
All right, so how does that optimization actually play out? What are some of the specific ways AI is being used, according to these sources?
Well, one really significant application is fatigue risk prediction. This seems like a huge deal. Traditional systems, they mostly just count hours worked, right?
Yeah, they don't really know how tired someone actually is.
Exactly. They're reactive, not proactive. The sources mention an anecdote from a Dr. Lee, an ER doc, talking about how cumulative fatigue after several tough shifts just skyrockets the risk of errors. It's common sense, but systems haven't tracked it well.
And AI can somehow anticipate this fatigue.
That's the idea. By analyzing data, could be past shifts, rest times, maybe even data from wearables about sleep, commute details, or self-reported stress levels, the AI models try to predict an individual's fatigue risk before a shift.
Wow, okay, so it's looking deeper than just the timetable. It's trying to gauge the actual human state.
Right, and it's not just about flagging the risk. The system can then, act on it, maybe automatically adjust the schedule to ensure enough rest, send reminders for breaks, or help managers balance out those really demanding shifts more fairly across the team.
That sounds incredibly useful.
It seems so. There's mention in the sources of an ICU pilot program where implementing this kind of fatigue monitoring was linked to a noticeable drop in reported burnout rates.
Just by identifying it early.
Yeah, identifying it early and then actually doing something about it, adjusting schedules, providing support. That proactive element feels key for both safety and staff well-being.
That connection between predicting fatigue and actively reducing burnout. Yeah, that feels really significant. Yeah. What else? What's another major area?
Another big one is preference-based scheduling. This tackles a common source of frustration: how shifts get assigned. Historically, it might have been first come, first served, or just down to the manager's discretion.
Which, can easily feel unfair or arbitrary to staff.
Definitely. AI offers a more systematic and potentially fair way. Staff can usually input their preferences, maybe preferred shifts, days off they need, perhaps even colleagues they work particularly well with via some kind of app or interface.
Okay, so they get some input.
Right. And then the AI's job is to try and honor as many of those preferences as possible while balancing all the constraints. Things like ensuring adequate patient coverage, having the right mix of skills on duty, respecting working time rules, and crucially, factoring in that fatigue risk we just talked about.
So it's like a complex puzzle solver, trying to find the best fit for everyone within the rules.
Exactly. And the benefits reported are pretty compelling. The sources mention it can significantly cut down the admin time needed to build the rota, sometimes up to 50%.
That's huge for managers.
It is, but maybe more importantly, by making the process feel fairer and giving staff more say, it seems to boost morale and can lead to lower staff turnover, which of course saves the hospital money on recruitment and training down the line.
Yeah, I can see that. There's an anecdote here about a Mr. Kapoor, an administrator, saying staff felt more heard, the rota seemed fairer, and complaints dropped significantly.
That feeling of fairness and being heard, it really matters for day-to-day job satisfaction.
Absolutely. But okay, healthcare is unpredictable. What happens when things go wrong? Someone calls in sick unexpectedly, or there's a sudden surge in patient admissions. The old systems often struggled with that, right?
Massively. That rigidity was a real weak point. The sources use the example of, say, a flu outbreak suddenly taking out several staff members on a ward. Chaos ensues trying to fill the gaps.
So how does AI help there?
This is where dynamic rescheduling tools come in. They're designed specifically to be flexible and react quickly, almost in real time.
So if a gap opens up?
The system immediately sees it. It then assesses who's available, considering not just if they can work, but if they should, looking at their skills, their location, their current fatigue level. It also looks at what the ward needs, right? Then patient acuity, required skill mix.
Okay, so it's a very intelligent search for a replacement.
Right. It identifies suitable candidates and proposes the optimal solution to the scheduler, who typically still makes the final call, but the legwork is done instantly.
It's not just finding anyone, it's finding the right person, considering their well-being too. That's clever.
It seems to be. The sources suggest this can reduce the time it takes to fill those urgent gaps by as much as 70%.
Wow.
And it also means less reliance on potentially very expensive agency staff called in at the last minute. There's another anecdote from a nurse Patel who apparently called the AI tool a lifesaver during a COVID surge because it helped them plug critical staffing holes so quickly.
You can absolutely see how that would be vital in a crisis. That real-time responsiveness is key.
Definitely.
You also mentioned skills and experience earlier. How does AI weave those in beyond just filling emergency gaps?
Well, traditional scheduling often kind of treats staff like interchangeable cogs, right? Which isn't realistic in healthcare. AI enables experience-based team composition. It can analyze the skills and experience levels across the staff pool.
And match them better to the needs of the shift.
Exactly. So ensuring you have, say, more experienced nurses on duty when dealing with particularly complex patient cases. The sources suggest this leads to better patient outcomes.
Makes sense.
And it also opens up possibilities for training optimization. The system could potentially identify skill gaps within a team
Oh, interesting.
by seeing the overall skill profile. Then it could even help schedule junior staff members alongside more experienced mentors, facilitating on-the-job learning. It's not just filling slots, it's actively helping to build team capability and invest in staff development.
So the AI isn't just an efficiency tool. It's potentially supporting professional growth, too. That's a really interesting angle.
It shifts the focus slightly.
Okay, putting a system like this in place sounds, well, pretty complex. How do hospitals actually implement this? The sources mention India specifically in some contexts.
Yeah, they touch on the implementation journey. A big piece is obviously data integration. You need to pull information from various existing systems, HR databases, the electronic patient record, historical scheduling data, maybe even those wearables, if they're used.
Getting all those different systems to talk to each other must be a challenge.
It definitely can be. That's why data standardization is so important. The sources mention using standards like FHIR, which you might recall is like a common language for health data exchange, to make that data flow possible.
Right, helps connect the dots.
Then you need the actual AI models developed for the specific tasks, predicting fatigue, balancing preferences, handling the dynamic rescheduling, and of course, building user interfaces that are intuitive for staff and managers to use is critical for adoption.
And security, privacy. That must be paramount with all this staff and patient data.
Absolutely non-negotiable. Compliance with data protection regulations is essential. The sources suggest a phased rollout is often the way to go. Maybe starting with pilot projects in 1 or 2 departments, learning from that, and then expanding. Partnering with local tech experts who understand the context can also be key.
It sounds like a significant project, but the potential payoff seems pretty substantial if you pull it all together.
Right.
Can you sort of summarize the overall impact, the big benefits we're seeing described in the sources?
Sure. Looking across the board, the benefits seem to touch everyone. For the administrators, it's clear time savings on the often tedious task of rota creation and management.
Frees them up for other things.
Exactly. For the hospital financially, there are potential cost savings mainly through reduced staff turnover because people are happier and less need for expensive last-minute agency cover.
Okay, that makes sense.
But maybe the most crucial impact is on the staff themselves. Improved satisfaction and morale, fairer schedules, feeling heard, and crucially, systems actively working to prevent burnout. That's huge.
And ultimately, that feeds into patient care.
That's the connection the sources make. Better staffing, potentially fewer errors due to fatigue, the right skills being in the right place at the right time. It all points towards improved patient care and safety.
So it really sounds like a transformation, taking ROTA management from this, often frustrating, stressful process.
And turning it into an intelligent tool that supports well-being, boosts efficiency, and helps the whole hospital system become more agile and responsive. That's the picture painted here.
It really is fascinating how applying this kind of intelligence to what seems like a back office function can have such a direct positive effect on the people delivering care and, by extension, the patients.
Yeah, it's not just process improvement for its own sake. It feels like it's about intelligently supporting the human element at the heart of healthcare.
Like technology working quietly behind the scenes, not just to streamline things, but to genuinely underpin the well-being of the workforce.
Exactly that. Enabling a more sustainable and perhaps, as the sources suggest, a more humane way of working in a very demanding field.
A smarter and more humane healthcare system. That's a powerful idea to end on. So for you listening, something to think about, perhaps. What does it truly mean for healthcare when technology starts working silently, not just to fix processes, but to fundamentally support the well-being of the people providing the care? That's definitely food for thought as we wrap up this deep dive.